Thank you very much, Mr. President, and I really want to thank Ms. McMillan, my staff, both Sharon Ledner, as well as Councilmember Duando's staff, who he'll thank, so I won't steal his thunder there, who worked tirelessly over this past weekend and over the past week, basically, to really come up with something that helps to become a start for addressing some of the racial inequities that we see when it comes to health and health outcomes in our communities of color, primarily our African American community in this case. I also want to thank Councilmember Navarro and Councilmember Albornoz for working with us as well at the beginning in terms of saying this was something that they were working on and they wanted to make sure that we were doing something in the African American community to address the disparities there. So thank you to both of them for their continued partnership with us. And then I want to thank Councilmember Duando specifically for partnering with me on this initiative, and then all of you in terms of your continued support for something that we know is incredibly important to all of us. It's not as though any of our districts, regardless of how many people are comprised in each district, don't represent. We know that there are health inequities in every single district, in every single neighborhood, all across our county. And we need to address this in a time in which people are losing their lives. And unfortunately, what we're seeing is in our Black African American community that folks are losing their lives at a much higher rate than what we see in other communities. And that says something. That speaks to what Councilmember Duando led us through before in terms of racism as a determinant of why we need to declare a public health emergency. It is something that speaks to our OLO report in terms of how racism affects public health outcomes for our communities of color throughout this county. Look, so this is a no-brainer, and I appreciate the fact that everybody has treated it as such. I really want to thank Dr. Kroll and Dr. Gales for working with our African American Health Program, and really want to thank the executive committee and the community partners who all came together on numerous conference calls to discuss with us the proposal as well as the initiatives and how quickly we were able to move forward. I will just say again that this is not something that is easy. I know that Councilmember Navarro and Councilmember Albornoz talked about it in terms of how quickly they stood theirs up. Same thing applies here, and that only happens with willing, able partners who believe that the work needs to be done and supports it and figures out ways to get it done quickly. And so I just really want to say thank you to all of the partners. Now, again, I will stress this is the beginning. Just as we saw in the Latino Health Initiative proposal, there are things that we know are going to continue. The CDC, World Health Organization, our own Dr. Gales have all warned us about the impending fall spike. And so from that perspective, we know that there's going to be more that we're going to have to do the second we reconvene as a county council. And so I look forward to working with each and every one of you to continue to address these issues. Hopefully we don't see a spike as large as what they're projecting. Hopefully we don't see a spike at all. But the reality is we didn't project a summer spike. We never said, the summer was supposed to be our lull. It was supposed to be the time in which we would catch a breath. And we haven't seen that. In fact, we've seen the exact opposite. So from that perspective, I really think that this is the right thing for us to do at this time to address the immediacy of need that's out there when it comes to some of the testing, when it comes to some of the community outreach, when it comes to making sure that folks understand why they are more at risk based on some comorbidities, based on existing health conditions. And I'll just close with this. I remember a phone call from my aunt to my mother in March saying, Vivian, you don't need to worry about this. COVID doesn't affect Black people. I've had family members that have died from COVID. Many of us have. We know what it means, how it affects us and impacts us. And so I hope that people take this seriously. The reason why I care about this issue so much is because to lose your life for something that could be prevented is one of the worst of all deaths. And so from that perspective, we've got to do our part. We've got to make sure that we're supporting folks, that we're giving them the information, the right information, the real information that they need to help them to be safe, to be secure, to make sure that they have access to treatment and make sure that they can have better outcomes than we're seeing right now. So I thank you, Mr. President.